Hello, my name is Dr. Anamika Joshi. I'm an oculoplasty specialist practicing in Hyderabad. Oculoplasty also contains treatment of watering apparatus of the eye, so that means I'm an eye watering specialist. So today we'll be discussing about what should you do if your DCR surgery has failed. So sometimes it can happen that despite the best efforts of the surgeon and despite a very good surgery, a DCR surgery, that is a Dacryocystorhinostomy surgery, can fail. DCR surgery is a surgery done for blocked tear pathway of the eye, in which a new bypass route is created between the eye and the nose, and through this new route the tears now drain. Now what happens is, sometimes even after making this bypass route, that is even after the DCR surgery, the body can cause some reaction and it can close that pathway that was made by the surgeon. This happens in less than 2 to 5% of patients if it is done by a good surgeon, and in case if it is done by if it is not done well, then the failure rates can be even higher. But in very good hands and within the hands of trained specialists, the failure rates for DCR are between 2 to 5%. So if the surgery has failed, that means if your DCR surgery has failed and again you have the problem of watering and discharge, then the options that you have are, you can go for a revision DCR surgery. Now revision DCR surgery can be done both by an external route or an endonasal route. But I personally prefer external route for revision DCR surgeries, because externally when you do it, you can have a better visualization and a direct visualization of the pathway. And in my hands, in revision surgeries, I get better results with external revision surgeries. However, saying that, even endoscopic surgeries can give good results, and it's a surgeon's choice and also patient's factors, like why has your DCR failed? That is an important question that first needs to be answered, and based on that the surgeon can decide whether they want to go for an external or an endonasal route. Now, revision DCR surgery is essentially done in almost the same way as the first DCR surgery. Maybe if we feel that the patient cooperation is not very much, maybe we'll add general anesthesia for revision surgery more commonly than we do for the first DCR surgery. And revision DCR surgery is slightly more challenging for the surgeon, because everything is slightly altered. The normal anatomy is altered. There is fibrosis inside. There is usually little more bleeding inside. But having said that, revision DCR surgeries also give a good result. Based on patient to patient, the success rate of the surgery can differ. In general, if I have to give you a figure, I would say around 50 to 75%, and sometimes more and sometimes less. 50 to 75% generally we get. This is the success rate that we get after revision DCR surgery. Personally, I would say I have done so many DCR surgeries which have failed earlier when they were done somewhere else, or when they were done some years back, and after doing the revision surgery, I've got pretty good results and good success rates. So if your DCR has failed, you need to visit an oculoplasty surgeon, understand the reason of the failure, and after that you can go for revision DCR surgery. In the minority of patients, sometimes revision DCR surgery can also be done for another second time also. That means total of 3 surgeries also we have attempted in very rare cases. Usually one revision DCR surgery is good enough if it's successful. Now another thing is, if your revision DCR also fails, or if the success rates for in your case are very low, then another option is to undergo a surgery known as DCT, that is Dacryocystorhinostomy. In this surgery, we don't create a new pathway. Rather, what we do is we take away the tear pathway sac, the tear sac of the eye. So that means we are essentially destroying the tear pathway of the eye. Now this prevents infections. If you remove the tear sac, which is the nidus of the infection, you are basically completely removing the infection part of the tear pathway. So this is what we do in this surgery DCT. Now if you remove the tear sac, you are disturbing the tear pathway, and that means after DCT, patient though will not have any infection, but there will be lifelong watering. And that is why DCT is the last alternative. The first choice is always trying to do a revision DCR surgery. If revision DCR surgery also fails, then the last resort is to go for DCT, in which the tear sac is removed. So if your DCR surgery has failed, please visit an oculoplasty surgeon, and they will explain you in detail regarding what is good for you in your case, and then you can make an informed decision. Thank you.